Hi, I'm Dr. Wright. Let's look at some background to your headache problem and why this new treatment may help. We see many patients who consult their doctors with headache symptoms. These include throbbing, pulsing pain, sensitivity to sound and light, nausea, aura, vomiting, or in some cases, eye tearing and runny nose. Different people have different triggers and symptoms. After taking a patient history, we make a diagnosis of migraine or cluster headache. Drug treatments are usually prescribed, but in many patients they fail to control the symptoms, and so we are constantly in search of new and better treatments. Let's look at why these disorders may occur. This is called the vagus nerve. It is the communication superhighway between your brain and other parts of the body, such as your heart, lungs, and digestive tract. The vagus nerve sends certain messages from the brain down to the body and back to the brain again. These messages are sent to the brain to activate chemicals called neurotransmitters. Neurotransmitters play an important role in how our bodies function. There are neurotransmitters that excite our nervous system called excitatory neurotransmitters, and there are neurotransmitters that calm the nervous system down called inhibitory neurotransmitters. Because our bodies like to be in a state of balance, the brain's activity stays normal by constantly balancing these neurotransmitters. In headache, there is a theory that headache symptoms are due to overactivation of the excitatory neurotransmitters and a reduction in, or simply not enough of, the inhibitory transmitters involved in pain processing. Actually, a person with headache has a brain that is biochemically different from the brain of a person without this disease. A person with headache may produce an overabundance of a neurotransmitter called glutamate, possibly as a result of a lack in the inhibitory neurotransmitters that normally keep glutamate levels in balance. As a result, sensations that are normally not painful become sensed by the brain as being unpleasant and painful, and so the headache symptoms are felt. There are lots of causes for the overexpression of glutamate, like stress, lack of sleep, alcohol, or even certain foods. A new approach to treating these disorders is to apply a specific electrical signal to the vagus nerve as it travels through the neck en route to the brain with the gammaCore device. gammaCore is unique in that it safely and effectively can restore balance between the excitatory and inhibitory neurotransmitters, blocking the pain caused by the increase in glutamate in your brain. It's a little like rebalancing the system that may bring you relief from your headache pain. Using gammaCore is easy. Before turning on the device, place your fingers on the neck and locate your pulse. This is the area where your vagus nerve is. Now, place conductive gel about the size of a pea on each of the two stimulation surfaces on the gammaCore. Next, position gammaCore on the skin, overlying where you felt the pulse in your neck, and turn the device on and slowly increase the stimulation strength. You should begin to feel a vibration sensation as you increase the strength of the stimulation. You will know you have achieved the correct stimulation or dose level for you when you feel a slight pull of your lip on the same side of the neck you place the device. Your physician may refer to this as a lip draw or tug, and this is perfectly normal. The duration of each treatment varies for each patient, but can range from 1 dose to 2 or 3 stimulations or doses a few times per day. Your physician will help you to find the appropriate treatment schedule for your type of headache. So there you have it. The gammaCore is an entirely new, non-drug approach to treating headache. Vagal stimulation is already used to treat epilepsy that is unresponsive to drug treatment, so we know it is safe. And unlike many drug treatments, there are no appreciable side effects.